Good morning. This is Larry, and I'm coming to you live from Stevie's room. Today's topic is feline upper respiratory infection. This is very common. The symptoms display similar to a cold. It's not contagious to humans. It is highly contagious to other cats. Cat sneezes, lethargy, loss of appetite, typical cold-like symptoms. Um, it's not something that should be lightly addressed, however. I've seen everything from the extreme negative, where the cat has died in 2 days, where it just gradually got severely worse and the cat died, um, and to where the cat has kicked it in 2 days without any treatment. Um, the general course, however, is about 5 days of a very sick cat that really is not feeling well, and doctors generally do prescribe antibiotics to hedge the secondary infection which could occur. What I mean by that is, since viruses are not treatable with antibiotics, the actual viral infection has to run its course. However, it also creates a breeding ground for bacteria when there's mucus in the lungs, and that can turn into a bacterial infection, which can develop into pneumonia. And antibiotics are used to treat bacterial infections. Um, they can start with milder antibiotics and graduate if the cat gets severely ill. We have had very mild upper respiratory infections. We have had some really severe ones that required a stronger, more powerful antibiotic in the secondary phase. We have had 2 cats die from it. We have had many cats survive it. They typically will show other behaviors, like they get quiet, they go in a corner. Don't ignore these things. Get them right to the doctor. If you see a cat behaving, they mask their symptoms very well. And this thing can turn out of control really quickly. So you may have a cat that goes into a corner. You think it's sleeping, but it's not really just sleeping. It's really sick. Um, and I'll give you an example of my most recent upper respiratory. The video I shot yesterday of Osvaldo with Ham. It's a cute video. But I noticed at the end of the video, Ham sneezed. So I took a good look at him after that video, and Osvaldo did too. And he had an upper respiratory. We got him to the doctor. He got a mild antibiotic, and he's doing better today. So this is, he's going to be fine. I believe that, but he's being monitored. He this is not something to be taken lightly. And it was something as simple as just a little video where I saw him sneeze at the end, and it wasn't just a typical sneeze. It was, it was like he sneezed on Osvaldo. Still was a cute video though. Anyway, it is something to deal with. Please be aware of these things. Don't ignore them. And good luck. Be safe, be well, and I hope this helps. As far as the antibiotics themselves, I'm going to leave that between you and your doctor. There are many different types. There are some that are injectable. There are some that are tablet. There are some that are liquid. You can discuss those things with the doctor. Since I'm not a doctor, since I'm not a veterinarian, I don't want to start naming them. I just want to tell you that getting your cat the attention it needs with this is something that should be highly considered before it gets worse. Thanks for listening. Be well.